So what medication error is? So to ensure we all are aligned, a medication error is formally defined as any preventable event. So this is a preventable event. This is not something which we cannot avoid or something which cannot be preventable. So it is a preventable event that may cause or lead to any inappropriate medication use when the medication is in the control of any of the healthcare professional. So let it be any one of us who are going to deal with these neonates. So whenever we are dealing with any kind of medications, we have to be so cautious that we do not cause any harm to the patient, since it is a preventable event. And neonates are entirely, as we know, they are non-verbal. They cannot express by saying anything. It is only that our clear vigilance, the way we observe, what we observe, clearly tells us what is wrong with the baby. So, why is the NICU classified as an exceptionally high risk environment when compared to the adult care units? So, that is because they have, first of all, these infants are physiologically fragile. So, they are very small. They are prone to get any sort of any errors can occur very soon with these babies. So they have micro dose requirements. That means whatever dose we are administering when compared to the adults, it is very less when we are giving to the babies. Their weight changes rapidly. Sometimes babies may have increased weight gain, or sometimes the babies can lose weight drastically. So depending upon that, we need to adjust our doses. So they have micro dose requirements. The weight changes rapidly, and they have incredibly a narrow therapeutic window. And the second part here is their hepatic and renal systems. So the hepatic and renal systems are very immature, because in adults the drugs whatever we administer, it metabolizes very quickly, whereas in these neonates, and moreover they are babies who are born more prematurely, their hepatic and renal systems are immature, meaning that their bodies cannot what you call metabolize or clear medications quickly. So any dramatical error can lead to drug toxicity in these babies. Because neonates have virtually zero physiological reserve, the clinical impact of an error can be catastrophic. It can be a life-threatening event leading to severe adverse drug reactions, leading to severe life-threatening events, also prolonged hospitalizations, and also mortality. So if we have seen, there are studies which have shown that the medication errors in NICUs are 8 times higher when compared to the adult wards or in adults. So the statistics say that they that we have to be very careful. We as neonatal nurses or the whole neonatal team should be very careful, very with complete keen observation to prevent these kind of medication errors, especially when we are dealing with these small neonates. We utilize this medication error severity that by NCCMERP, that is National Coordinating Council for Medication Error Reporting and Prevention. They have categorized the types of medication errors based on its severity. Like for example, you see it is categorized between category A to category I, like where you identify the error and know what you call, where circumstances are in such a way where we are almost going to administer the medication, but then we realize and then no error occurs, to category I, where an error occurred and it has contributed to the death of a person or a neonate. So these are the different categories where medication errors are categorized. Like for example, just wanted to bring it to the notice. Like recently, there was a news which is coming in that we lost a baby, a child, a 3-year child, due to a medication error or due to our negligence. So in order to prevent these kind of medication errors which can lead to the death of somebody, we have to be very, very, very careful. So let us see what are the common causes of errors which contribute to these kind of medications errors. Like we have categorized into human factors or LASA drugs or even calculations. So human factors can contribute to like mental slip. Sometimes when the workload is high, and we it goes out of our mind. Sometimes we forget to hand over that we have already administered the medication, where the other person assumes that the medication is not given and then tends to give up the medication the double time, and and then the stress factors, lack of knowledge of drug, poor handwriting, and improper labeling. Coming to the LASA drugs, that is lookalike and sound-alike drugs, there could be confusion when when it is told to us to administer one drug, then we mistaken it to be another drug, then we end up giving that particular drug. And then these abbreviations like writing in short forms and giving verbal orders, like for example any high risk medication orders, verbal orders, and then decimal calculation. As Priyanka ma'am rightly said during the beginning of the session, decimal point errors, we cannot take any risk of these decimal point errors. And also at risk population, that is our neonates. Let us see what are the types of medication errors. These errors can occur right from the process of prescribing till the medication, till the monitoring errors. So the prescribing errors can happen when the prescription is written and then it is given to the pharmacy, when the pharmacy analyzes it wrongly and then transcribes it and then dispenses it from the pharmacy. So this dispensing error can also occur when we are trying to indent a medicine, but we end up indenting wrong. So it can be from the stores to the pharmacy, or from the pharmacy to the wards as well, and from the ward we when we are administering to the baby, there the administration errors occur. And then monitoring errors. So there are few drugs which require keen monitoring. Let us even take a simple drug like caffeine, which is very commonly used in our NICU to prevent this apnea of prematurity. So we should know the knowledge of every drug. For example, most of the babies suddenly have tachycardia because of caffeine. So these kind of things, which these minute things should be addressed properly. It should be brought to the notice so that we don't end up causing errors in the babies. So whenever the prescription is written, see to that it is appropriately written. It should be clear, legible. It should be written in capital letters. The correct dose should be written. And numbers are often written maybe in wrong manners, leading to adverse drug reactions. So always make sure the handwriting is clear and it is legible. And any medicines, if you all are prescribing, please make sure that it is written in capital letters. And also to prevent these kind of errors, as rightly said, like decimal value should always be written with preceding zero. For example, if you are going to administer, if the doctor advises us to administer 0.5 mg of a drug, but instead of writing it as 0.5 mg, always make sure that zero is before that point. So it should be clearly 0 point. That point should be clearly visible. If not, we will be mistaking it as 5 mg and then we end up giving 10 times more the dose. And even the abbreviations, only the approved abbreviations should be used. So abbreviations like BD, TID, OD, or HS should be avoided. Instead of that, we should always make sure that it is written. For example, if it is TID, you can either write thrice a day or 8th hourly. If it is an OD drug, either write it as once a day or 24th hourly. So this is how we need to make our team to write the medication orders. So only approved abbreviation should be used, and prescription should be documented clearly with all the above details, like for example, patient name and MBAR number, and it should be complete full name, the doctor's name, signature, date and time. The dispensing error, as I told, the dispensing errors can happen at any of the levels. Like for example, when we are trying to indent medicines from, the error can occur from the vendor to the stores, or from the stores to the pharmacy, or even from the pharmacy to the wards. Hence, to prevent these kind of medication errors, we follow something known as drug reconciliation or reconciliation of medicines, where following this allows us to avoid duplication or omission of drugs. And also, if you can just see in the drug reconciliation form, there is something known as last date and time of the last dose, which will clearly tell us when was the last dose it was given, how it was given, where it was given, what was the drug route, frequency, so that we avoid these kind of errors occurring. So the nurses must reconcile the drug coming to the wards from the pharmacy or from the other wards, and this documentation is very much necessary. And to prevent any dispensing error in OPD, the pharmacy staff should always properly read the prescription before the dispensing of the drug. And even if they have any sort of confusions in reading the prescription, it is better that they always clarify before dispensing these drugs. And also and this frequently we can come across in OPDs. In NICU, yes, we always we should always clarify with our doctors, but in OPDs, when the medicines is prescribed, when the parents, when they go to buy the drug from the pharmacy store, the drug name, the route, the dose, and the frequency should be clearly instructed to them. Like for example, the minute doses, like administering any drug, like for example 0.2 ml or 0.5 ml, that should be administered for the baby. What is the frequency that should be administered for the baby? This all should be instructed very clearly. Now let us see what are the measures to prevent medication errors. So the 10 rights of medication administration errors should not be skipped. It is always the 10 rights, that is the right patient, right drug, right route, right dose, and right time, followed by the right documentation. And remember, whenever we are doing something or administering something, and if we are not documenting it, it is as equality of not doing it, and we end up doing it again, or miss or not doing it. Also right education, like for example, when the patient is getting discharged or when the baby is getting discharged from the NICU, educating the mothers or educating the parents regarding the particular drug, how to use it, when to use it, what is the dose that they should use it, what are the side effects that they have to notice in a baby if any drug is administered or overdosed. So this all should be educated. Right assessment after administering the drug, the what you're supposed to assess in the baby, whether the drug is really effective for the baby or not. So this all should be documented. uh, where we can find errors happening, like for example, when we are prescribing the error medication prescriptions, illegible handwriting that can lead to misinterpretation of the drugs. And whenever such thing occurs, there is, whenever you have any doubt, it is always that you reconfirm. There is people may think, okay, if I go and ask the doctor, maybe when the schedule is busy, the doctors may get irritated or they may get angry. There is nothing like that. There is no wrong in making ourselves look like fools than causing any errors or leading the baby to a situation where it cannot be revived. So it is always to make ourselves look like fools but not causing an error. So it is always double checking, reconfirming from the team. And it is always a teamwork. We should always work as a team with the doctors and the nurses. So as I said, nurses should always remain alert and ensure accuracy while documenting medications. And the medication name, whenever the prescription is written and whenever the medicine is dispensed, the nurse must always recheck against the prescription before administering to the baby. Like if you just can see these two images when I am comparing, when I say about illegible handwriting, for example, here in prescription orders, if you can just see, it is written in cursive handwriting and hardly anybody can read that. Whereas in the other picture, if you can just see, it is very clearly legibly written, and medications are written in capital letters. The dose, the frequency is also written appropriately. So this is how the treatment orders or the prescriptions should be written. And failure to verify these 10 rights of medication can result in medication errors and also serious patient harm. So make sure that every medication that you are going to give for the baby, you always be careful and check with the doctors before administering. And especially with high risk medications or look-alike or sound-alike medications. And following the identification principle is very important. That is, whenever you're going, identify the baby. Sometimes we may have babies with the mothers with same names, two different babies. Always make sure that you check the baby's name and MR number completely. Verify it with the prescription orders, whether the medication is written for this particular baby, the dose, the dilution, everything, and then only administer the drugs. So as I said, you should always verify the medication name and the concentration. Always calculate. As I said, there are in neonates, it is always the weight-based calculations. So never what you call assume the weights for the babies. It was always check the baby's weight and then the dilutions and administrations should be taken place. For example, here, if you can just see, there is a misinterpretation because of illegible handwriting, where the nurse fails to double check it. And instead of ordering or indenting one drug, she has indented another drug, where instead of cross checking, she has already administered the drug, and then patient has landed up into a serious adverse event. Now, in the next picture, if you can just see, there is again an illegible handwriting, but she was very careful before she could indent the medicine and administer the medication. She has again cross-checked with the doctor, and then after that, after cross-checking, she has indented the right medicine, and the right medicine has been administered to the patient. Coming to the right route, always verify the prescribed route of medication administration. Ensure that very clearly it will be written that the particular drug should be given oral only or should be given IV only. So always make sure that you read the label properly. For example, if you just can see here, bupirosin, it is when it was prescribed, it was very clearly mentioned as local application. Even syrup caffeine, caffeine we get in two forms, that is injection and oral as well. So in injection it is clearly written as injections only, and for oral it is written for oral use only. So make sure you read these things which are mentioned already. Verify the prescribed timing, frequency, and dosing interval before the administration. And this all happens when we are documenting it correctly. And assess if the medication time is critical. For example, if you're giving any iron antibiotics or anticonvulsants or inotropes, we have to be very careful with the timings which is prescribed. Documentation is very essential. As I said, something which we are doing it and not documenting is as equal as of not doing it or not performing it. So ensure correct signing whenever you're signing it against it. Write the correct date and time. The nurse should prepare and administer the medication properly and document it wherever it is possible. Avoid delay and incompletion and incomplete documentation. The rule of zero, as initially when we have discussed, the misplaced and invisible decimal points are the most common cause of errors which can happen, and it can happen in 10 folds or even 100 folds if we are not documenting or if we are not legibly writing it. So always use a zero before a decimal point, and never use a zero after a decimal point. If the doctor prescribes or if the doctor advises to give in the drug as zero point 0.5 mg, make sure that it is written as 0 point. The point should be clearly visible, and 0.5 mg should be written. And when the doctor advises you to give 5 mg of any drug, it should not be written as 5.0. It should be single numerical number. The whole number should be written as 5 mg instead of 5.0, because sometimes if the point is not clearly visible, we end up giving 10 times the dose of whatever is required for the baby, and which can be toxic or even fatal. The small dose volumes is the smaller the dose volumes, the higher the risk of babies, higher the risk in the NICU and for the baby. So always recheck the medicines whenever you're diluting and whenever it is administered. Coming to look-alike and sound-alike drugs, it is, as we have said, it is LASA drugs and the high-risk medications. Whenever any look-alike and sound-alike drugs are there in our unit and in our setup, it should be stored separately. And look-alike, sound-alike drugs should not be kept together. And the color coding is very clearly defined. As for look-alike, it is always given in green, and sound-alike, it is always mentioned in blue, whereas the high-risk medications are always in red. So highly vulnerable, the neonates are highly vulnerable due to their waste-based dosing and small medication volumes. So these medication errors involving LASA drug can result in serious harm in these critically in neonates. So always make sure the nurses, as nurses, we play a very crucial role, because it is we who are there 24/7 with the babies in our NICU. So as nurses, we should be carefully monitoring the baby and whenever you are administering the medications. So read the medication prescription, and whenever such situation arises where we are getting confused, pause yourself, read it, verify it. There is no wrong in re-asking or repeatedly asking the doctors. So verify, double check before every administration. Now let's look into what high risk medications are. So high risk medications, these are medications where any slight change or increase in the dose can be life threatening to the neonate or to the patient. Where these medications have this low therapeutic index. So low therapeutic index means the range of dose at which the drug has beneficial effect on the patient is very small. So even a small increase in the dose can be a life-threatening event. So be very careful whenever we are administering any kind of high-risk medications for the babies. Always double check, and double check. So this is how the iris medications and sounder like drugs or lookalike drugs, if at all it is there in your wards, are stored separately. In whenever if there is a crash cut, it is stored in a zigzag manner so that you do not get confused. So this is how the medications are stored, and always use Tallman letters whenever the doctor is prescribing in a medication or writing the medication in the medication chart. Always use the Tallman letters. For example, if dopamine is there, DOP should be written in capital letters followed by small letters in order to avoid confusions in these lookalike and sound-alike drugs or high-risk medications. So we accurate weighting and dose calculations, as I said, the dosing, the prescriptions are based on babies' weights. It is a weight-based calculations for the babies, and once the baby has crossed its birth weight, the calculation should be done at the present weights. But as long as the baby has still not crossed its birth weight, the calculation should be done with the baby's birth weight itself. And never estimate the neonatal weight. Be very careful. Double check the decimal points and the unit conversions. And use of syringe pumps for precise neonatal dosing. So as we all know that whenever we are administering any drugs in the neonatal, whether it is through infusion, it is always what the administration is very precise and small dosing. So you always use syringe pump for these administrations. And check for infiltrations and extravasation. If the child is crying continuously, look for what is the discomfort. If there is any signs of redness at the cannula site, immediately inform to the doctor, and if possible, remove the cannula, because if at all, if we may think that it is only redness and there is no swelling, but it may cause infiltration, extravasation. Sometimes even in worse scenarios can also cause necrosis of the tissue as well. So be very careful when you are administering these kind of drugs. Open vial and syringe policy. So drugs which are available in vial, for example, if it is a multi-dose vial can be used for 28 to 30 days, where we are writing the date and time of opening. And after 30 days of opening, we have to discard it. And one small example of multi-dose vial I can give you is injection insulin. So this is a multi-dose vial. But when a vial is opened for dilution of an antibiotic, so always read what it is written. The reconstituted medicines, it should be whether it should be kept it in a refrigerator after reconstituting, or it can be kept in the room temperature, and it should be used within 24 hours. It should not be kept for more than 24 hours. So within 20, after administrating for 24 hours you can give, and then it should be discarded. The loaded syringes. So whenever the loaded syringes are there, make sure you write the dilution. What is the drug? The complete name. What is the dose? What is the dilution? With what ml you have diluted? What is the dilution what dilutant that you have used to dilute that particular drug? So label the reconstituted medicines like what I just now told you: patient's name, MR number, name and volume of the IV fluid, name of the drug, and the amount added. This all should be written carefully. Coming to the cut strips, sometimes the doctors may ask us to give any tablet form, the drugs in a tablet form, where we indent it from the pharmacy. So whenever we are getting these kind of cut strips from the pharmacy, please make sure that the pharmacy sends you all with these particular details. That is, whenever the pharmacy sends you, in the brown slip they have to mention the name of the medicine, what is the strength, the expiry date, and the batch number. Please do not receive any cut strips without these details. And as I said, what are the medications that has to be stored in the refrigerator and what should be stored in the room temperature. Please make sure that it is followed. The storage in the fridge only for medicines, like for example, there are some medicines which will be written clearly as stored to be stored between 2 to 8 degrees. So those medications should be very clearly stored between that particular temperature, failure of which we may lose the efficacy of the drug. So some of the common mistakes in drug administration is, like for example, if you can just see in this picture, the doctor has prescribed gabapentin, and it was indented the wrongly, and then failure of recognizing this can cause to medication errors. So high concentration drugs should be diluted to achieve the safe neonatal doses, because as I said, everything is weight based, and the small volume drugs that we give for these neonates. So here errors which goes unnoticed can cause massive errors or massive adverse effects in the neonates. So standard protocols for doctors here is always write in capital letters whenever if you're writing the medication slips or the medication charts. Include generic name and brand name. Define the dose strength and the route and direction of the medicine properly, so that the nurses, whenever they are diluting the drug, they do not get confused, and they have that fearlessly they can come to you or approach to you of verifying the drug if they have any doubt. And at the nursing level, remember, check all the labels before the orders are given before administering. And if it is any high risk medications, always verify with your seniors or with any two qualified people, let it be nursing professional or even with the doctors. Do not, before you could administer, please verify it 2 times. And even when you're administering the medication, see to that it is signed by two qualified people. And discard any unlabeled medication immediately. Do not assume the medicine to be this particular medicine, but if something which is diluted and which is not labeled, kindly discard it. When we are talking about administration, medication administration and dispensing, prevention of these errors, ANTT also plays an important role. Let's see why ANTT is so important. ANTT is nothing but aseptic non-touch techniques. And whenever we are administering any drug that is through IV, always make sure the scrub the hub technique is followed. You should always use the alcohol swabs whenever we are scrubbing, so that we do not introduce any infection into the IV line, and allow the hub to dry completely. But it is not that just you have with the alcohol swab you have just done that scrub the hub technique and then you have directly connected to the line. No, allow it to dry completely, and then you introduce or you start your administration process. And once you have done the scrub the hub technique, do not again touch the hub after doing the scrub the hub technique. Monitoring and ADR recognition. So whenever you are administering any medication, always the baseline vitals are important. Please take down the baseline vitals. And during these infusions, especially during the high risk medications, whenever we are administering, so always monitor the infusion rates during the infusion process, or in between or post infusion. Always monitor the baby's again vital signs, do the respiratory and heart rate assessment, check for any signs of adverse drug reactions. If you find anything, please immediately stop the infusion and inform to the doctors immediately. And reporting does not mean we are playing the blame game over here. It is nothing to blame somebody over here. It is just that we avoid these kind of errors. So whenever you find any medication error happening, let it be a small medication error, like to the major medication errors, please see to that you report it to your seniors or in charges or to your higher authority, so that we may come to know what is the when go into the ground level and identify the problem. This is, as I said, it is not to blame somebody, but to avoid these kind of errors in the future, where we do not cause any severe harm to the babies. For example, if you just can see over here, one of the nurse was administered the injection wrong to the patient. Her colleague has seen the error happening, but she failed to report to the manager thinking that she's a senior. How can I report it about her? It may it may give a negative implication. And then the higher authorities, they are like everything is going smooth, but whereas when we are not rectifying, these kind of errors keep on repeating. A small example here, a critical nurse where she tries to catch up with the morning medications after the patient's condition changes and he requires several procedures. So he's intubated. So she tries to crush the pill, whereas this pill has to be given it where it is clearly mentioned as you do not have to crush. So whereas she fails to notice that and she crushes, and then it has landed where where the patient has landed into asystole and the patient finally dies. So please make sure whenever these kind of drugs are there, please verify again and again. So only way to ensure that chances of errors are minimized is to always check and recheck before taking the next step. And as nurses, I can only say that we are the end point here. When we are 24/7 with the babies, it is we who need to observe every minute detail in the baby, every minute change in the baby, everything that the baby is trying to tell you. The babies never speak, it is the baby tries to tell you with various changes happening in the babies, like the physiological autonomic changes in the babies after or before administration of the drug. So please make sure that we as nurses are should be very vigilant, very observant to identify these errors and avoid these kind of errors, and use the current weight. As I told you, if the baby has not crossed birth weight, use the birth weight, and if the baby has crossed the birth weight, then use the current weight, and never ignore the decimal points. Please make sure whenever any drug which is written in decimal points, before the decimal point, please mention it as 0, but there shouldn't be any decimal point after writing the dose. It should be written as a whole number. And avoid infections, prevent infection, follow the scrub the hub technique. And also, as I told you, reporting these kind of medication errors is not to blame somebody but to change our work culture. Thank you.